Hello, my name is Jason Taylor, and I am a student nurse with Allegheny College of Maryland. Thank you for watching this educational video presenting to you information regarding a blood disorder called sickle cell disease. There are two parts to this video. Part 1 with myself, Jason, and Shanita Campbell, my associate who's also into this program, in which you will see in video number 2. My goal for you in this video series is for you to gain knowledge of sickle cell disease and be able to discuss material with your classmates, identifying populations at risk, and also utilize wellness techniques to aid someone with sickle cell disease. Accompanying this video is a PowerPoint presentation filled with viable information and a short quiz, just to test your knowledge to see where you are after this video. And now, on with the presentation. Sickle cell disease is a blood disorder that runs in families, which means that it's inherited. People make abnormal types of hemoglobin called sickle hemoglobin. Hemoglobin carries oxygen from lungs to organs and tissues in the body. Abnormal hemoglobin can make red blood cells turn sickle-shaped in certain conditions. People with sickle cell disease often have a condition called anemia. Anemia can cause the shortness of breath, have pale skin, and have low energy. This disease is common in African Americans or someone of African American descent. According to the CDC, which is the Center for Disease Control, says about 1 in every 365 African American babies in the United States is born with sickle cell disease. And worldwide, approximately 300,000 babies are born with sickle cell disease each year. That's quite a bit. So how does one get sickle cell disease? It's a very good question. Like I said before, sickle cell disease is an inherited disease, meaning it comes from mom and dad. A person who has the sickle cell disease trait may never have symptoms, but a person born with hemoglobin traits, one from mom and one from dad, may likely have complications that lead to the diagnosis of sickle cell disease. In the next scene, you will see a genetic scheme, which I created, which depicts the way a person may or may not be a carrier of sickle cell disease and a person who has the disease. Take a look. So what is the effect of sickle cell disease on a person? Well, normal blood cells are round, smooth, and move freely in the bloodstream. Now, a person who has sickle-shaped red blood cells, the blood cells will interrupt the flow of blood as seen in the animation on the next screen. So take a look at the next screen and get an idea of what normal blood flow looks like versus what blood flow looks like with an interruption with sickle-celled cells. Take a look. As you could see with the first flow of blood, normal shaped blood cells were moving freely in the bloodstream because they were full of oxygen, so they move smoother and freely through the veins. The sickle-shaped cells in the vein that you saw on the bottom does not carry oxygen. So at that point, it causes the blood to start to, so to speak, pile up, sort of like at the junction there you saw. So it wouldn't go one way or the other, it would just stop right there. That right there itself can cause a person to suffer with pain anemia, and eventually, if that was a buildup enough, it could also lead to a stroke. So what causes the severe pain in sickle cell disease? Well, severe pain in a person with sickle cell disease is also known as a sickle cell crisis. The pain is sometimes random. Some who have pain may be able to deal with it just fine because it is so infrequent. However, others require a trip to the hospital and may have a stay overnight in the hospital because of the pain. The following can cause the sickle cell crisis: infection, like a urinary tract infection or an infection in a wound that didn't heal very well, very cold air, dehydration, meaning they're not getting enough liquid, enough water, or whatever they need in order to stay hydrated, they're not getting enough. The next thing, it could be extreme physical activities such as football or soccer. And stress such as school, relationships, and family can really drive someone into a sickle cell crisis. So complications of sickle cell disease include recurrent pain crises, stroke, sepsis, which means that there's whole body inflammation caused by an infection, delayed growth and development, which is something that really needs to be monitored for children who are suffering from sickle cell disease, and delayed puberty and prolonged erection in boys, which is known as a priapism. A person should seek medical care as soon as they start feeling these symptoms come along, such as chest pain, high fevers greater than 101 degrees, which may indicate that infection, and signs of stroke, which include weakness or numbness on one side or either side of the body, I should say. They cannot talk. They have a really bad headache. Some say the worst headache they've ever had in their whole life, and dizziness. So let's wrap up, shall we? Here I'm going to tell you some key points that you might find interesting or may even find on your quiz. Sickle cell disease is a blood disorder that runs in families, which means it is inherited. This disease is a common in African Americans or someone of African American descent. Sickle-shaped red blood cells interrupt the flow of blood, which can cause pain, stroke, or anemia. Severe pain or sickle cell crisis is caused by severe infection, like a urinary tract infection, cold air, dehydration, extreme physical activity such as football, or stress like school or relationships. Thank you very much for watching part 1 of this series on sickle cell disease. Please click on the second video where Shanina will wrap it up for you. Thank you.